So yeah, thanks everybody for joining us today. So my name is Natasha Twinor. I am the Executive Director of the Canadian Association of People Who Use Drugs. And yeah, I'm really happy to be here today to do our webinar on recognizing expertise. So for the international guests that we have today joining us, I'll explain what a land acknowledgement is. And that is something that we do here in Canada to always pay recognition to the land that we are situated on, which was not rightfully ours to begin with. And so with that, I'll move into a land acknowledgement. I would like to acknowledge that the land that we live, work, and play on is the ancestral and unceded territory of the Indigenous people of Turtle Island. Acknowledging territory should take place within a larger context of genuine and ongoing work to forge real understanding and to challenge ongoing colonialism. We strive to collaborate and respect all Indigenous tribes of Turtle Island. Every individual and every institution has a role to play in making the needed changes to dismantle systemic racism and oppression against Black and Indigenous peoples in our society. And yeah, so I guess I'll move into our guests next. So today we have Sam Patton, our amazing researcher that we've been working with, community-based researcher, as well as Michael Nurse and Jen McCrindle. And I'll also go through a few of the planning committee members who are helping out in the background and give them a wave. So Savannah from the Dr. Peter Center, who will be watching the chat, is helping us out today. And of course, Shay, the stimulus program coordinator, who is doing background tech. Yeah, so welcome to Stimulus 2013. And we're excited to get going on this work. So Stimulus is a co-collaboration between CAPUD and the Canadian Drug Policy Coalition. Sorry, I'm losing my words today. So I have Shay's words in front of me here. It says 3 words I'm hoping that we can all keep in mind today is patience, kindness, and humor. Bringing people together to meet and engage in new ways. And sometimes unstable technology will not be without hiccups. So if you have any issues, you can reach out to Shay or you can reach out to Savannah. And digitally mediated activities already put distance between us, but please join us in creating a safe space for everybody that's here today presenting and for others also in the chats and the questions. Yes, and so from there, I would encourage you each to introduce yourself through the chat. So you can put your name, where you're from, your organization, and because we have over 300 people that registered for the event. So yeah, looking forward to see who's here in the chat. A little bit of housekeeping rules. So today, if you're going to be tweeting, we are using the hashtag StimulusConnect. Number 2, questions for panelists go into the Q&A. It's that little Q&A box down at the bottom of your screen, which Savannah and I will be watching throughout. You can even upvote those to let us know which are the most favorable questions or questions that you'd like to hear the most, and we'll be looking at those. Savannah and Shay can help you with any technical issues, and Savannah is monitoring Q&A as well. The event is being recorded and will be available on the Stimulus website in the future. If you're having problems with the sound going in and out, turn off the oral interpretation when you do not need it. And then Stimulus Connect website has over 19 resources thus far, and we are identifying more. Today, we'll add those. If you have others, please put those in the chat and let us know if you have anything that's on topic related. And all of them will be provided on the Stimulus website with links so that people can access those. And then lastly, we welcome questions in either French or English. As we have Sophie here that's doing the French oral translation, and Nick as well. We have folks joining us today from the African Network of People Who Use Drugs. Woo-hoo! That's really exciting. Denmark, the United States, so we have 4 states, Oregon, New York, Michigan. We have Spain joining us, people from Tanzania, Rwanda, and Nigeria. And from all over Canada in communities like Oliver, BC, Saint Jerome, Quebec, Addison, Alberta, Grand Manon, New Brunswick, and Duncan, BC, and Flin Flon, Manitoba, just to name a few. What I had said earlier was like the stimulus program is a program that is based with the Canadian Drug Policy Coalition, but it's a collaborative initiative between CAPUD and CDPC. And since the pandemic hit, we sort of revamped and went into all these online formats because unfortunately COVID has made everything online. But most of our content has been curated by our committee, our executive committee, and the SNP committee, and we talk with people on the ground to bring forth, drug policy initiatives, harm reduction initiatives, things that are really hot topics that need to be discussed that generally are not discussed in these types of formats. And so, yeah, I think that's what I have to say today about the Stimulus Connects in general. But this one especially is one that's near and dear to my heart because it's about the best practices, community-based research that we've been doing. And yeah, so this came about because CAPUD has oftentimes been invited to events or on the fly have been having to advocate for how to properly include people who use drugs in equitable and just ways. And so that means through honorarium or how to involve people. And it just had really seemed to me that there was a big leg or lacking in evidence or documentation, especially by people who use drugs. So anyway, I don't want to keep chatting about this, but I'm super pumped that I have my peeps here with me today to explain the research piece. And I will hand it over to Sam.
Okay, thanks, Natasha. Hi, everybody. It's lovely to have you all with us today. I'm here in Halifax, otherwise known as Chibuktuk. For those who are wondering, this awesome t-shirt, which explains what I do for a living, sex, drugs, and harm reduction, is from SWAP, which is the Safe Works Access Program out of AIDS Committee of Newfoundland. So it's a fundraiser they were running a while back. So get your t-shirts. So thanks, Natasha, for running us through a bit of the rationale. I just wanted to show you who the research team was. We had an awesome team of researchers across Canada, including Natasha and Shay, Matt Bond from CAPUD, Jen McCrindle, who you will meet briefly, or in a brief moment, Michael Nurse, who you will also meet. Jen is close to Red Deer in Alberta, and Michael's in Toronto. Wyatt Knoll is here in Halifax with me. Joshua Edward, also in Halifax. Marianique Blanchon-Gagnon is in Montreal, and myself. So we had a really great team. We worked together really well. We really want to thank all the participants. I hope some of you are on the call today. Thank you so much for completing the survey and participating in the interviews. That includes people who use drugs as well as organizational representatives.
Sam, do you mind if I just interject for 1 second? I don't mean to throw you off your role. I just want to recognize as well that this work here, we would like to dedicate to people that we've already loved and lost. That, due to this drug war and due to opioid poisoning or drug poisoning. And those individuals are who we dedicate this research to. One that comes to mind right now is Karen Turner. Jen and I had talked about dedicating this work to her because she was so exemplary in her work with people who use drugs. And so I didn't say that at the beginning, but I thought it was really important to say. I apologize for interrupting.
No problem. Thanks for that, Natasha. Okay, so this is the most boring slide of all of the ones you're going to see today. It just gives you a quick run through of all the steps we took, our methods. We started with lit review, so much good literature that's already out there about how to meaningfully include people who use drugs and respect their input. Shay has created an inventory of all these resources for you on the Stimulus Connect website if you want to check that out, do some extra reading. So our first step was to recruit and train our wonderful research assistants, starting with Michael Nurse and Jen McCrindle. They learned in a real hurry all about qualitative research and research ethics, and proved to be natural researchers, which is really great. Together, we developed the data collection tools. We pilot tested the interview guide and the survey, and we had everything translated into French. And then we made sure that we had a really solid sampling and recruitment strategy to make sure that we had good representation from across Canada and a whole variety of demographics. We distributed the online survey to people who use drugs across Canada through our own personal and professional networks, and then did the whole snowball kind of strategy. We ended up with 230 survey participants, and we targeted recruitment of those participants to make sure we got maximum diversity and representation. Of those people who filled out the survey, 66 were eligible for a telephone interview. We did have overrepresentation in Ontario, so we stopped recruitment in Ontario and then made sure that we had coverage across other parts of the country as well. We transcribed everything and made sure that we accurately captured what people were saying. We worked also on including organizational reps. We interviewed 18 of those people who convene meetings and conferences and workshops, and people who deliver harm reduction programming. And we together as a team did the whole qualitative analysis process. And if any of you have been involved in a process like that, you know it's very tedious, very arduous, but also fun, I venture to say. And we are now in the final phases of writing up the report, making sure that we're capturing everything and creating some really helpful best practice recommendations. So in a nutshell, this is what our survey respondents look like. We use the screening survey to try to capture people from across Canada, and we wanted some specific criteria met for follow-up interviews. So while we collected data in the survey that was really helpful, we also used the survey to identify people that would be helpful to interview later on. And we targeted people who said that they had used illegal drugs within the last 5 years, currently reside in Canada, are 18 years or older, and had experience working in or volunteering in harm reduction services, and or had experience attending and participating in harm reduction meetings, drug policy meetings, conferences, workshops, or other events. And of course, people who were actually interested in participating in an interview and shared their contact info with us so that we could actually follow up. So I won't go over all these pictures and graphs for you, but this just shows you the spread of people across Canada who we who we surveyed. As you can see, there's a lot of uptake in Ontario, and most of our participants were from urban settings. Ethnicity, about 73% of our respondents identify as white. We were happy to see that we had a pretty good representation across other ethnicities. Our age range was fairly young. 50% of our participants were in the age group of 18 to 35. Way more female identifying participants than other genders, which I don't have a problem with, but I think that's pretty great. And level of education, a really broad span there as well. We were really happy to see that. And this just shows you what people self-identified as their preferred drugs when talking about their own drug use. So I'm going to run, Michael, Jen, and I are going to run you through 7 major themes that we'd like to highlight out of our findings. The report right now is about 68 pages long, so we've just selected some of the top level findings that we thought would be most interesting to you and that give some real tangible guidelines around how best to acknowledge, respect, and incorporate the expertise of people who use drugs. So we're going to cover 2 topics focused around events, conveners of conferences, workshops, other kinds of events. And then we're going to talk about some of the best practice guidelines around harm reduction work and some of our findings there. So what I'll do is I'll give you an overview of the findings from each of those themes, show you an exemplary quote, something that was particularly hard-hitting for us in terms of interview excerpts. And then I'll get Jen and Michael to reflect a little bit on what they gathered from this theme and what they heard during the course of the interviews. So I apologize in advance for the too much text on this slide. They won't all be like this, but this captures in a nutshell the way that our participants, both people who use drugs and organizational representatives, the way that they described what should ideally be made available to people who use drugs when it comes to conferences, workshops, other kinds of meetings and events. And we have 4 main findings and recommendations. We recommend that organizations pick venues based on the ability to be able to provide the full range of harm reduction services to participants who are people who use drugs, including access to safe supply and or ethical drug navigators to assist with securing a supply, particularly
qui inclut bien sûr
by their own home jurisdiction. Harm reduction services should be provided with careful consideration of accessibility and privacy. And should on-site services be impossible, perhaps due to restrictive policies in the event venue, organizers should identify local or regional partners who can offer harm reduction services and resources in close proximity to the venue of the event. Host organizations and their local partners should also consider ordering surplus supplies to assist in what was called a pass-through of vital harm reduction tools to organizations or individual people who use drugs who can't access these tools in their own home jurisdiction. And examples of that are like safe inhalation supplies, naloxone kits, or drug testing strips. So on the right here is just the full listing of the kinds of harm reduction essentials that ideally would be at each and every event so that people can fully participate in such a meeting or conference. And just a quick quote here. I don't know, it wasn't my job, and I don't even know what the ethics around this look like, but I spent a substantial portion of my time at that conference sourcing dope for people. So I just want to leave that quote with you, and maybe I'll ask Jen, if you wouldn't mind, Jen, giving us some of your thoughts about what you heard when people talked about this theme.
Yeah, for sure. Hello, everybody. So for conferences, we got a wealth of information about what works and what doesn't work when people are attending conferences. When we were questioning people, we were trying to explain that we're talking about bigger scale conferences rather than workshops and meetings, because that kind of plays into their job role more so than attending events. So what I can tell you is that overwhelmingly, the participants, the list that Sam had on the slide before, the overwhelming amount of people suggested all of those services to be available at events, especially naloxone and harm reduction supplies. What was interesting to me that this ethical drug navigators came up several times because it is problematic for people when they're leaving their home communities. You know, do they bring their substances with them and travel and risk, you know, getting caught with it or having it taken away? Do they chance securing substances in a new city where they don't know what the supply is like? So to have somebody who is strictly sourcing substances for people at conferences is a huge thing, and it's kind of controversial, but it's to keep people safe while they're traveling and participating in other communities. What else can I tell you about conferences? Compensation was a big one. A lot of people are invited to speak or participate, but they're not being paid in the way that we feel that they should be. A lot of this is done voluntarily or to build a resume, we heard a lot. and people aren't always confident to ask about payment ahead of time. So that was a definite gap that we identified. And some more information will come out about compensation as we go. Yeah, we found that when a conference is organized with a harm reduction lens, people walked away from it feeling very empowered and inspired and connected to their community, which I thought was a really beautiful thing. On the flip side, when people are going to conferences, say, organized by a health authority or government bodies, it has a much different effect on people. Those conferences, people tend to feel tokenized and that they're there to check a box. That theme came up over and over and over in this research, was checking boxes. Yes, we've consulted drug users. Yes, we've heard what you had to say, but it's not going anywhere. It's not being implemented. Drug users don't feel like they're really being heard in these spaces. Yeah, so to treat people of value when they're speaking or participating at a conference, to explore people's skills and their talents and what they're good at, and give them roles and jobs based on that, rather than just a tokenizing, you're a drug user, so you're speaking on this panel type of situation. Really work with people to identify their skills and their strengths, and you would be amazed what people can do and what they want to do. Anywhere from designing websites for a conference to, venue selection, abstract considerations. People are begging to be more involved in all levels of conferences. I think that's it for this slide. Yeah.
That's amazing, Jen. And I don't know, do you have anything you'd like to add to that, Michael? And then I do have a question that sort of flows into this piece as well. But would you like to add something first, Michael, before I flow into the question? You're still on mute there. Darn mute gets me every time too.
Yeah, there's not much that I would want to add. I think that Jen covered pretty much most of what I've heard. There's one thing that stood out for me. It is that there's still this resistance or this thinking among people who use drugs that they're not at that place where they should be able to like use drugs and work at the same time. Because a lot of people, when you talk about having safe supplies at conferences, a few responses that I got was like, well, if you can't not use for 24 hours, then why are you being there? And some people would talk about, well, why would we have it at conferences or events? Like, why would we have that? And I feel like that is something that still needs to be addressed, because once you probe further or you add additional questions, people kind of sort of either were unsure of how they wanted to see things or stuff like that. So I'm thinking that there's still a lot of work that needs to be done, even though there's a lot of understanding about having harm reduction services available at events. There's still a lot of work that has to be done for people, even people who use drugs, to feel comfortable with that happening, because people still feel a resistance to that idea. That's what I want to add.
Thanks for that, Michael. Yeah, and I think that there's a lot of societal norms that have been instilled to us that think, a lot of us feel like if we're not the way that we're employable or the way that we need to be in places is we need to present as somebody that doesn't use drugs, and therefore, so then after that's ingrained into us for so long, that's how we feel like we have to move forward, is we have to comply with the things and the stereo norms that we hear in society. So that's a very good point as well. So one of the questions that came through was interested to hear more about engagement of people who use drugs as it relates to harm reduction planning. And so I'll kick it off to you guys in a second, but I think as it relates to events, I would say people who use drugs should be at the beginning phases, not brought in at the end, right? And so like you can plan all the harm reduction events, but if you're just going to bring us in to review things at the end, it's not going to work well. So, meaningful engagement or like equitable or just opportunities for people who use drugs generally start with the beginning phases in the developmental stage and through the implementation and facilitation of the event. And then I'll kick it off to Jen and Michael and see if you'd have anything to add to that.
We heard overwhelmingly different ways to include people who use drugs, everything from, art spaces and music spaces, places of expression, right up to like plenary speakers. Absolutely, drug users should be involved from the planning stages and choosing the content of the conference to the location. Literally every step of the way should be led by drug users.
Oh, I was talking on that time. How about you, Michael? You have anything to add? Oh, you're on mute.
Yeah, again, not too much. I echo that most people wanted to see people who use drugs being involved in the development of an idea or a program that directly related to the lives of people who use drugs. I feel like the thing that isn't clear is about how that works or when that works. It is clear that people want to know about the idea to help shape the idea or for a program or for policy from the time it is an idea so that it doesn't move forward. But that is not what's happening now. So even though some efforts are being made to include people with lived experience in developing policy, a lot of the times it is after the idea has been thought about and then that decision to involve people is made. But there's still a lot of work to be done, to be done in this area as to where are people involved at which point.
Yeah, thank you for that, Michael. And yeah, Sandra, I don't know if you had anything to add in there as well, or?
Yeah, basically setting the theme of the event, the conference, reviewing the abstracts that come in, creating the invitation list, deciding on venue and location. A venue should not be chosen that is prohibitive of all these harm reduction services, for example. All right, so can we move on to the next theme? Alrighty, try to get myself organized here. All right, so the next thing we want to talk about with respect to events was how and when to pay people who use drugs for their expertise. I think one, we need to make sure that we acknowledge that people who use drugs are experts, just as a physician, a nurse, a PhD researcher is an expert in what they do. People who use drugs bring invaluable, unique, and impossible to get elsewhere expertise. And Shay put this so well yesterday, so I just quoted Shay. Experts get paid with money, not gift cards. You don't invite a physician to an event and offer to pay them in grocery gift cards. It's just insulting and paternalistic. Ensure that travel and meal expenses are covered, of course. We know that people don't often have a lot of expendable funds at the ready, so we need to make sure all of those expenses are covered up front. People who use drugs should be paid for their participation in the form of cash at a daily rate comparable to the host organization's own staff. I think that's a really important standard to set. If people who use drugs are invited to speak or present, they should also be provided with an additional honorarium. So not only they should be given payment for their attendance and for bringing their expertise to an event, but if they're asked to speak or present, that should be added above and beyond. If traveling outside of one's community, hotel accommodations and any arrangements for OAT medications, opiate agonist therapy medications, and childcare need to be clarified before departure. make sure that's crystal clear and people don't arrive with surprises. And with respect to form and timing of payment, each person who used drugs, participant, should be given the opportunity to state their preference. And it was interesting in the survey, we asked, when should financial compensation be given so that people who use drugs can meet their needs while at the event? And you'll see there's quite a range here, with the majority of people saying daily allocation. Others might prefer the entire thing up front. Others might prefer it all at the end. So I think it's really important just to go with have flexibility and go with what people feel will be best for them. This is a bit of a longer quote, but an important one. It's frustrating when you're asked to do something, but the pay hasn't been established right away. And the ask is, well, you're asking me to speak about this topic that you know that I'm passionate about and that obviously I want to speak about, but for some reason, he didn't approach me in a professional manner by saying, we have this opportunity and we're able to pay this much, and are you available to fill this position that we need on the panel or as a presenter or whatever? So it's kind of like they sell the dream and then they tell you what they can afford, and then it's up to you to decide. But you're passionate about it. And oftentimes it's like having to choose between making a difference or standing up for yourself as a professional. So that's what I wanted to show you from our findings. I'll open it up to Michael and Jen. Michael, do you want to take a go first? Tell us a little bit about what you heard when you asked people these questions.
I'll take a pass. I'll take a pass on this.
Let Jen stick in, but I found this part very, very interesting, especially around timing of payments. I was very surprised at the differences in like the daily allocation. I was like, oh, I really thought it was going to be different than that. So, people are surprising, not surprising, but to me, I guess it was surprising. But anyway, I'll let you speak to some of the interviews that you had done, conducted, Jen.
Yeah, for sure. And really there was such a range. What works for one person will not work for the next person. And we heard it time and time again that conference organizers really need to do the groundwork ahead of time with each person, not the organization, with the individual, to identify what does work best for them. I would say, yeah, the majority of people did say daily allocation, preferably in the morning. So if they need to use to get well to be able to participate, then they are able to do that. But yeah, it really does depend on, are they coming from another community? Because some people would like that money up front and they need that to travel or procure their substances before they attend. So I guess my takeaway from this part of the project is that, really do the groundwork with people individually ahead of time, and don't leave it to the organization to decide. It needs to be an individual allocation of funds.
Yeah, I agree with you, Jen. And they have to be very clear on what it is that they upfront, because people use drugs when you're inviting somebody to a conference or you're working out these processes with them. It shouldn't be up to them to have to advocate for themselves. I think that, we do oftentimes, we're like contractors and we have to contract ourselves out and sort of speak for us. But I know even from CAPUD's perspective that this has always been sort of an area of contention, because nobody likes to get onto the ground and have to be actually advocating while they're already there on how to properly include us. And that means equitable pay, to, as San had already alluded to, to the conference organizers or the hosts themselves. They're paid to be there, as should we. This is work for us when we go to these conferences. So yeah, thanks for that. And Michael, did you think of anything you wanted to add, or you just want us to move on?
Yeah, we can move on. I think Jen pretty much covered the point I was going to make.
Okay, thanks, Michael.
Sorry, Natasha, I would also just reiterate that things like hotel rooms that are secured ahead of time, so people don't need to worry about having a credit card or how that works. Hotels and travel really need to be standardized. If someone is leaving their home community, it is too stressful, too expensive for people to have to worry about how they're going to get places and coming up with the money to do so. So if you are asking someone to leave their community and participate in a bigger scale conference, absolutely travel and accommodations need to be standardized.
Yeah, and the deposit should be paid up front by the hosting organization so that they aren't faced with trying to check into a hotel and then put on the spot that they may not have a credit card at that time and have to feel sort of embarrassed in that situation when they had already thought that that should have been taken care of. So yeah, there needs to be some really thoughtful considerations into planning these types of events with people who use drugs. Yeah. Well, if you want to move on there, Sam, go ahead. Sorry, I didn't mean to take over there, but I just
no questions. No questions.
Passionate. There was a couple questions here. Yes, but where do you think, or where and when do you think expertise is taken for granted? I think we sort of spoke to that, right? That sometimes organizations feel like we should just go there for free, but maybe Jen, I'll kick it off to you.
Yeah, Natasha, I think this does come up in the next slide, or there's next couple of slides about feeling valued and respected. So maybe I'll just wait till we hit that point.
Okay. Did you have anything, Stan or Michael, to add to that one?
No, I don't.
Okay. And there's one other question though I thought was interesting that may fit here was, what suggestions do you have for incorporating the expertise of people who use drugs among the large institution organizations that would host these events? What would be your recommendations to them to, how should they incorporate the expertise of people who use drugs?
Well, absolutely at the highest levels, obviously, ideally at board and planning committee levels, but also within the staff, basically at every level of an organization. I think it's important to not be tokenistic and have just one person who represents an entire population of people who use drugs, and make sure that you're inviting people that represent a diversity as well, a diversity of perspectives.
And I did see just one, I didn't look into the upvoting. I don't want to stick on this one section, but I think it's it is important. Somebody says, an anonymous attendee said, I could see some formal agencies, and have in brackets like government, RHAs, being nervous around liability, around providing a paid ethical drug navigator. While the HR potential is obvious, is there any discussion around how to get around that liability concern?
Would they be equally concerned about an overdose death happening at the event? I mean, kind of speaks for itself.
that should be a very serious consideration for somebody, right? Like, yeah, ethical drug navigators or substance navigators, whichever you like to, they're life-saving interventions for people. And yeah, maybe it is in HR, but I think it would be worse on the opposite side without one. Did you have, any of you have anything to say about that before we move on?
I believe that if, Michael here speaking, I believe that if the intention is to involve the people with expertise from the experience in using drugs, that if that is the intention, then I don't believe that liability would be allowed to prevent the development of a mechanism or some way for people to be involved and not make an organization feel at risk. If the intention is to involve people, then people would be involved, and what is needed to be done to move people forward would be done. It is done in different areas. I believe that the challenge here in this area, from what you mentioned, Natasha, is stigma. And I believe that stigma is the underlying issue there in that question that you raised.
100% agree with you. Thanks for that, Michael.
Thanks, Michael. Okay, we're going to move on now to talk about harm reduction work. And this is a theme that we called feeling valued and respected. And it's a fairly broad theme. It captures lots of different elements, but this is essentially what we mean by the kinds of conditions, workplace conditions, and dynamics that make people who use drugs feel respected and valued within their workplace. A living wage that's equitable to other forms of expertise that are comparable to a social worker or a nurse, for example. A strong and supportive team, so good cohesion within a team, being treated as an equal, being respected as an equal. Ongoing opportunities for mutual training and skill development. We'll talk a bit more about training and skill development in our next theme. Having a job title that's meaningful and conveys one's actual expertise and role, and not just the fact that they may or may not have used drugs now or in the past. Providing letters of recommendation for workers so that they can move on and up. Create opportunities within the organization that aren't just focused on the drugs we use, but actually focused on our skills and the aptitudes that people who use drugs bring to their role. Organizational leaders and all staff should receive training on equity, diversity, inclusion, and accessibility. Recognize people who use drugs' expertise and incorporate their input into decisions. If we say that people who use drugs are essential to our services, making our services more relevant and effective, then they should also have a say at the highest level when it comes to setting policies and procedures at the organization as well. And providing regular and meaningful debrief and emotional supports for harm reduction staff, which we will also discuss in a bit more detail in one of the themes. So just as an exemplary quote that we heard about from the interviews, I think if organizations actively sought feedback, like if there was a weekly or monthly sit down and there was a section of time carved out for specifically like feedback about the work, and allowing frontline staff to have more of a say in terms of strategy and policy delivery, because often there's not full consultation with frontline staff, despite the fact that they're the ones that are going to be implementing or responding to or delivering the actual policy decisions in terms of like how they're felt by the service user. So I think allowing frontline staff the time and space and encouragement to be able to really candidly talk about what they feel like the impacts of the policy will be, or provide feedback in terms of how to shape and deliver policy, that would be beneficial. So Michael or Jen, what did you hear when you were talking to people about feeling valued and respected?
I absolutely heard time and time again that a decent living wage would be the best way for organizations to show people are valued and respected. Way too many workers across the country are doing this work for far less than minimum wage, sometimes $7 to $10. So it's hard to feel valued when you're not making a comparable wage to others within the organization, or much less, nurses or social workers. It's not even a comparison. Another thing that, it didn't surprise me, but it surprised me how often I heard it, was the strong and supportive team. That means a real lot to people, to have others, have their backs, support them through hard times, support them through good times. To have open communication with their team was really important, and not feel like they have to hide, maybe something they're going through or their own drug use or whatnot, but being able to talk openly with their team members was hugely important to people feeling valued. And I thought that was really cool. I've had the opportunity to be a part of some really good teams, and I absolutely, I can confirm that it really does. It helps your work. It helps you personally. For myself, it helps in my recovery. So yeah, having a strong supportive team is huge. And there's seemingly small ways that you can create more cohesion in your team. I heard a lot about people wanting more check-ins, more team meetings. Some peer workers aren't even invited to their own organization staff meetings. So within their own organization or team, they're being tokenized and they're being left out and to some degree isolated from decisions or practical implementation of the work. So that's a seemingly small way that people can be more valued and respected, is to bring them to the table and have open dialogue with your team. Another thing that I liked in this section was the letters of recommendation and different ideas people had that they felt would help them to feel valued. I heard things like award ceremonies, for example, or write-ups in a magazine, sponsoring somebody for a holiday dinner, letters of recommendation. If they're not full-time employed in harm reduction work and they are doing things more ad hoc, informally, then provide a letter explaining their talents and their skills and their uniqueness and how they can serve another organization or another opportunity. I thought that was really cool. And that's also a simple thing that people can do that would mean an awful lot to people who use drugs. We don't have a lot of, resume experience sometimes, or, practical work experience. So providing letters of recommendation would go a long way. I think that was my main takeaways from this section. Also more training. I know we're going to get to that in a minute as well, but people are begging for more training. And when organizations provide that to workers, it makes them feel valued and like there's been an investment in their professional development, and people are begging for those opportunities for more training, more education, and putting their learning into practice.
Yeah, and Jen, so I remember us having a conversation, I think maybe later on it's covered, but another thing was having paid vacation and benefits and having the same, those allocations that, other staff in those jobs do. So like not just being called like a peer hypothetically and being, boxed into a certain place and not being accepted as an employee, like with benefits, with health benefits, with vacation and sick pay and all of those things as well, was another way that people felt valued. I don't know if you remember speaking to any of the participants about that as well.
Sorry.
Okay, I hit you on the fly with that one.
For sure. That's all I got at the moment. Sorry, Natasha.
That's okay. How about you, Michael?
Yeah, what I wanted to add around the feeling valued and respected, I feel like there were different responses, but there was something that connected most of the responses for me, is that in doing the work, people wanted to be seen, they wanted to be heard, and they wanted to be responded to in meaningful ways. The thing that, for me, that underlies the involvement for people who use drugs, that involves that when people become involved in the work of delivering services or building a policy for people who use drugs or for those services, is that when we tap into the experience that underlies that expertise, when we tap into that experience, there is a lot that is there for a lot of us. There's a lot of trauma, there's a lot of guilt, there's a lot of shame, and it is being able to go to that space and come back constantly, go to that space or live in that space, and then shape that in a way that could be useful to an organization. And I feel that people feel that often that is not seen, that is not respected, so the support isn't there. And what I think that I heard the most that stood out is that you could go to many meetings, that many organizations have many meetings, and you can go and you can say, this is going on for me, or this is what I'm seeing. but it seems as though there's already a response already shaped. So that when you're finished saying that, you see the next day that what you had to share wasn't even reflected in decisions that were made. So it is that, like, you're at the organization, but your input is limited. There's only so much that you can talk about. Your involvement in the decision making about what makes it into to a decision within the organization is limited. And sometimes you, as somebody mentioned earlier, having not being considered staff, you're not even privy to information about what's going on inside the organization that could help you respond. So I feel it is like being real, like organizations being real and allowing the people who use drugs and are working within that organization to be real as well. As an add-on, it's not only people who identify as people who use drugs that have to face the challenges of using drugs, but also people within organizations who use drugs but don't identify as that because of the stigma and the discrimination that would come. So that if we're saying that we're creating environments for people to use drugs where they can feel valued, where they can feel welcome, where they can feel that this is a space about me, then we need to start making those changes. And not only saying that we're going to make those changes, but be on a mission to wherever those barriers exist, we're going to take them down. We don't want to dismantle them. It's not just talking about making change, but dismantling barriers. So that is what I heard. That organizations, like what some people say is that there would be a particular person in the organization, maybe a manager, maybe a coordinator, who might have a good sense of how to support people with lived experience, but it might not be an organization-wide thing, or it might be something that is just within an area that employ people with lived experience. But what is needed is to see how that organization can make the entire space welcoming and supportive, so that people can not only come in and bring their expertise, but they can grow within the organization or even outside of the organization.
Thank you so much for that, Michael. That was very well put. Sam, did you have anything to add before I go into a question?
Sure, let's go to a question.
Well, ironically, that one of the questions was like not really a question. It was a statement, and I think it really rings true. So I put here, it says, being called a peer when introduced, I feel judged and labeled immediately. My name is, and I won't say their name, and it has an exclamation mark. What's yours? So I think that very vividly explains the encounters of being not valued and respected with that title as well, right? So I will move into a question beyond that. That just really resonated with me when I was going through the questions. The first one I have here is how do we ensure people who use drugs lead in the development of programming for organizations who want to do work but are harmful, but it's harmful, I guess. Anybody?
I don't think I really understand the question.
So I take it as how do we ensure that people who use drugs lead in the development of programming for organizations who want to do the work, but it can sometimes be harmful to those individuals, I guess, but I'm just surmising that that's what it is. But how about just answering, how do we ensure people who use drugs lead in the development of programming for organizations who want to do this work?
Michael or Jen, you want to take that? Go ahead, Michael.
It's a policy within the organization that identifies at which stage people should be included, and it should be that the very beginning of the idea, the first time that it is discussed broadly as a working project, it should include people with lived experience. Yeah, I think that you wouldn't really go about looking to build a building without first making sure that you had an engineer on board that you would sit down and talk with to go about developing that work. I think the same attitude needs to be developed. But again, we're looking at stigma, generations of stigma that needs to be addressed still.
Thanks for that, Michael. That was an amazing response. How about you, Jen? You're good? You're good. Okay, so one follow-up question that I do think is really good. How do we know when people who use drugs, or sorry, what do we do when people who use drugs don't really seem interested in our project? And I thought, oh, might that be that you hadn't involved people who use drugs in the beginning of the stages for, so, I think that may be the reason why there wasn't interest in the program, but I'd be happy to hear what Michael and Jen or others have to say.
I would absolutely, sorry, Michael.
No, you go ahead, Jen.
I absolutely agree. If your program's not gaining the interest of people who use drugs, then you need to adapt and change your program and include them from the get-go. It's really that simple.
Yeah. Go ahead, Michael.
Yeah, I agree with Jen. It's, there is a lot of responses that I got from people in terms of where they were working, organizations that were established or that was receiving funding and stuff from where they were working. A lot of these organizations still built the delivery of the services on people exercising abstinence from using. And people who work, some people say that they work there, but they're not, like some people might come in because of the supplies that they offer and so, but at the point they're not tying into any programs because the programs have an underlying suggestion of abstinence and they're not there, abstinence. I feel that the programs need to be, I believe, informed by the people, or the service need to be guided and informed by people who are using those services. And part of it is not just doing a needs assessment at the beginning and then holding on to those findings to dictate what happens after, but being open to like a living needs assessment. When people come in and use the services, they can tell you what's working and what's not working. And it is that disconnect, that there's no realness. And I believe that that's why you get people who continue to offer the same programs and the same services, and they have no real response. You've got like 20 to 30 people sitting outside the center that really could deal with a particular service, but you're using the one that brings in no one, only when the food is being served. I mean, those are the things that really need to be looked at, and we need to get real.
All right, thanks for that. That's amazing. All right, Sam, let's move on to the next slide there, which is going to be a really interesting one, I think, for everybody to hear.
So yes, for sure. A lot of questions have come in about, okay, well, what do you suggest as good titles? And here we go. So this theme is all about when we ask people who work in harm reduction what they think about their job titles, we heard a real range, to be honest. We heard people saying they love their title, it empowers them, it conveys to people when they're called peer within their job title, it conveys to other people in the community, hey, I've walked the walk, I'm not just talking the talk, and I know where you're coming from. So it's an immediate identifier as somebody who's had that same shared experience. Other people fucking hate peer in their title. So what we've basically said as our conclusion is that organizations really need to collaborate with their workers to identify a job title that conveys the expertise, and I really emphasize that, conveys the expertise held by those workers, conveys the roles and responsibilities that are fulfilled by that worker. And again, not just the fact that they have a history or are currently using drugs. What their expertise is beyond that. And it communicates to clients at the same time that the worker has lived or living expertise and experience. So ideally, you're letting people know that I'm somebody that you can relate to, but does not involuntarily disclose a worker's current or past experience with drug use. So all of those things are pretty tricky to achieve all in one title, but some of the suggestions that I think were really great from our interviewees, harm reduction worker, coordinator, counselor, specialist, any of those, frontline worker, outreach worker, drug culture advisor or navigator, substance use advisor, and program coordinator. So hopefully these are titles that reflect what people are actually doing, as opposed to imposing a title that outs them involuntarily, letting people decide for themselves what their title should be. So here's a quote that kind of captures that tension. I've heard some people say that when they're working with their communities that they prefer the word peer, and it resonates better with the people that they're trying to serve or help. But then when they step outside and are trying to work with or educate other professionals, the peer title often holds them back, and they would prefer something like harm reduction worker, frontline worker. It works better with people like academics or professional type of people. So it's really interesting how a title can change people's perceptions of us, even though we're doing the exact same work. So yeah, I think it's an important point that the stigma and the judgment that comes with a peer title isn't from one's own community members, but from other professionals, quote unquote. So Jen and Michael, what did you hear about this set of findings?
Yeah, that summed it up really nicely, San. We did hear many times about, yeah, people feeling that internal stigma from the title of peer. And when they try to do work, you know, with health authorities or, you know, organizations outside of their own, it's been a detriment to people to have the title of peer worker, peer support, which is sad because, as San said, a lot of people feel empowered and, you know, like part of the community with that title. So to have outside stigma play a role in, you know, how you feel about yourself, it sucks. From what I learned from this was that management at an agency, of your agency or organization, really needs to work with you and identify, again, skills, talents, unique traits, specific work that you're doing, rather than just the umbrella term of peer. There's really great suggestions here. We heard a lot about how people identify as frontline workers and they're not considered frontline in the media or, you know, to the hospital or the police. Those, you know, the hospital, their police are not considering drug users as frontline, you know, first responders or frontline workers, and that's absolutely what they are. So I heard a lot of, you know, people being offended, I suppose, that their roles and what they do is being diminished by a title like peer. It's complex. It's really complex because most people do feel, you know, they're happy with that title, but when they try to move outside their organization or their own smaller community, it harms them more than it helps.
Yeah, Jen, I remember vividly in our team meetings when we were talking, you were saying how people felt very empowered to be able to, when they're working with clients who are also people who use drugs, that they felt empowered to be able to share that experience with them on their own terms, and how that made them feel very connected to those individuals, because then you know, it's something that they uniquely share together, and so they know that, you know, they get it. The person they're working with gets what they're going through, and they don't feel stigmatized in that interaction. But however, when it goes back to the organizational piece, however, it is stigmatizing within that workplace and like sort of pigeonholes them into like this one wage or this one thing, and they can't move beyond it. So I found that to be very interesting throughout. And yeah, Michael, I'll kick it off to you. I don't want to keep talking about it, but go ahead.
But by all means, I was listening there kind of intently. Yeah, so I think that everything everybody said kind of resonates. One of the things I find that, I know we talk about the job title, but I like something you were saying a bit earlier there, Natasha. What I was hearing, it is more about the work rather than the title. Particularly when people talk about how they feel like they can share with their families who they put through so much that now they've got a job at the community health center, or they've got a job at the recreational center. It is that okay that it feels, even as somebody mentioned, more empowering when somebody can recognize that, okay, I know that you've been through a lot, but that is precisely why we see your involvement here as extremely valuable, the expertise that you bring from that. So for me, it is about, what I heard most was about people talking about having their experience recognized and responded to, so that they felt, hey, this person knows where I'm coming from, they know what to expect from me. So like, it made them feel like empowered. And I feel like that is what was valued. I feel if you take the titles, because some people would say like they would say, okay, maybe harm reduction worker, I would choose maybe peer worker. I'm not sure. So I feel like there was nothing really that stood out in terms of what title would work best. But I figured that one thing is that not being outed as a person who uses, that should be your choice. And it should be your choice to use that tool to when you thought it was mostly needed. So it's about the work really, and not about the person who's doing the work. But that's where I see the titles of the work.
Very well put. Yeah, and because I think we know now peer is synonymous with being a person who uses drugs, right? Like it's just, that's what it is. I mean, we don't know any other profession that's labeled just a peer, right? And so it's actually part of your role. Like it's not actually the only thing that you do. It's like actually, you could say that you provide peer support to your fellow people who use drugs in your community, but that isn't the title of it. It's actually something that you do, like as part of your responsibilities or your job duties or responsibilities. And then that gives the person an option to be able to use that terminology and only give it to people they want to share it with and not have to. So I think people have to be conscious about that owning people against their will, even though they think that the title that they're offering is something that is empowering when in fact it may be detrimental to some individuals. All righty, so questions. I know I didn't get to a question on this one, did I, or have I? I got rambling away there with you guys. lost my way.
Shay, did you want to add something?
Well, part is I'm interrupting now. There are just some housekeeping things. So one, Edmonton Global Health, we're trying to chat with you about your raised hand. So please chat with us back. Two, I'm going to launch the poll in a second. And three, Natasha, there's a grand amount of questions in the Q&A that you may want to check in on because they're very, very specific to the current conversations. Sorry to interrupt.
Yeah, I didn't see any that were related specifically to this topic. That's why I moved on past it.
Okay. Are people okay if I just answer them if I can? And then because there's 10, right? There's a lot of them. So I'll try and answer them, especially if the ones related to events, because I feel like I know the data on that. So
yeah, and so there's also, we're going to have time for a larger Q&A session at the end as well that we can address some of these. So it wasn't that I was ignoring them. Yeah.
Okay, thanks.
All right. So I am looking through here to see anyhow, the questions that I had in front of me, because we had so many questions that were given to us ahead of time that I have like pages and pages and pages of questions in front of me. So I've been trying to focus more on those so that we could use these other questions for the Q&A. So the harm reduction, job titles, what's something that you'd like to see done differently in terms of how organizations currently involve people who use drugs? And so, yeah, I'll throw it out to you guys.
I'd go first and just say the organization should post the positions that they're looking to hire for, and allow people to apply for those positions. If they have a particular need in a position for a particular expertise, then that should be highlighted. I think that in most areas where you're delivering like street outreach or you're delivering drop-in services to people in the community and stuff, where you've got a high population of people who use, then you should have people with lived experience there who can relate. But I don't think that you have to call it, hey, a lived experience position, like period. I don't think that you need to call it that, but put it up for the position that it is, and you hire with an eye for the expertise that you need.
How about you, Jen?
I mean, not much to add that we haven't already spoken about, but I think organizations just really need to get creative and have a more respectful title than peer, more encompassing title than peer. Again, it's just about doing the work individually to come up with a title. That's my
All right.
message.
Thanks. And Sam, did you have any last words on this topic before we move on? I'm trying to scan two different sets of questions here at the same time, so go ahead.
No, nothing to add. Basically, the bottom line is work with individuals to come up with a title that they prefer, and don't unnecessarily out people if they don't want to be. Okay, let's move along in the interest of time. The next theme we want to talk about is also about working within harm reduction, and the training that workers receive or should receive, as well as the training that their colleagues and managers should receive. So most of the people who use drugs who we spoke to noted that they had received little or no formal training in relation to their harm reduction work roles. As people who use drugs, of course, they bring community connection, they bring understanding of drug culture, empathy for other people who use drugs that no amount of training can provide. That's a given. But what people wanted to impress upon us is that there's lots of other parts of their jobs that they sometimes felt ill-equipped for. Organizations that are the most innovative in recognizing and honoring the lived or living experience specifically framed that experience as an expertise or as an expert qualification. And organizations must acknowledge the unique community-based expertise on drug use and drug culture that people who use drugs bring, and draw from that expertise to educate other staff and managers. So if we truly mean when we say that people who use drugs are experts, then why the hell are we not drawing on that expertise to train other people in the organization to help them understand drug culture a little bit better, to help them understand how to work respectfully and without stigma with people who use drugs. And we have to also support people who use drugs so that they can excel in their roles, giving them comprehensive internal training that's tailored to the needs of each individual worker. And this training should include content knowledge, for example, HIV and hepatitis C prevention, some of the clinical sides of harm reduction, and actual hands-on skills, such as de-escalation of conflict, support and counseling techniques, how to administer naloxone. All of these things can be very specific to their roles in the organization and in the community. So we've provided a list here of some things that our informants identified as standard offer, which should be universally offered to all new harm reduction workers. And just to show you a quote, people who use drugs are the experts. And as somebody who isn't one of those people, my job is to help where they decide I need to. I can help and still continue to recognize that they are experts. So these things don't have to be in opposition. Just because you're recognizing somebody as an expert doesn't mean you're kind of hands off and say, okay, I don't need to train you on anything else. There's lots of aspects of the job, such as how not to take home all the work and all the grief and stress of your job, how to set up relationship boundaries, how to have healthy interactions with people in your community that you might have social connections to, how to maintain confidentiality, how to take care of yourself and prevent burnout, etc. So there's that whole list here that I won't read to you. So Michael and Jen, what did you hear? What really sticks out for you when you were talking to people about training for their roles?
Well, what sticks out for me is the lack of training that people have been turned out into their roles without, when I asked about, you know, what I considered pretty standard training to start a position, most people didn't have any Hep C or HIV education. Most people did have naloxone training, but there was some gaps that I wasn't expecting. I just kind of assumed that everybody would have HIV and Hep C training and nonviolent conflict intervention, that type of thing. Whereas I found there's a good portion of people that do not. And a lot of people are just kind of turned out, you know, just winging it with their own experiences and their expertise, for sure. But there needs to be a little more, you know, consideration for helping supporting people to do their job well. Another thing that I found interesting in this one was I heard it many times about they had no training on boundaries. And there was you know, they have a dual role in our communities, you know, because they're drug users, but then they're also in this working role. So to allow people to just wing it and expect them to know how to maintain healthy boundaries, or what the expectation even is from the organization, I mean, that's really tricky. That's putting a lot onto that person to expect them to know how to navigate these relationships. And I think, I mean, I can't remember the exact quote, but somebody had said in an interview that, well, I'm not supposed to sleep with or use drugs with any of these people. Like, too late, I already have. So once you've crossed that line, like, how do you have these boundaries with people in the community? It was really interesting. And such a lack of supports from organizations, you know, they could be punished for these, you know, boundary, I don't know what the word is, for not having effective boundaries with people, you know, so their organization can punish them, but they're actually not providing any training on how that person should manage those boundaries and relationships. So people are really left winging it on their own. And if training comes up, that's great. They're very excited to do so. But I really think that needs to be, you know, at the beginning of their employment, so that they're prepared and, you know, they feel confident in their role.
Yeah, thanks for that, Jen. And I know Michael, in one of our team meetings, we had Michael and I, and well, all of us, we had these really candid conversations around boundaries. And Michael, it reminds me of when we were speaking that day, and you were saying about, like, I'm a person who uses drugs, like, inside of this job, outside of this job. That's like, I will always be a person who uses drugs. So it's really hard when you're in these organizations to not be a person who uses drugs any further. And what was it? You just don't get rich and switch, right? Like, do you remember that? It's so stuck with me, right? So I don't know if you want to speak to something. You don't have to speak to that exactly, but I'd love to hear your thoughts on this.
Oh, Michael, you were
Muted yourself by accident.
Yeah, around the training, so with people who use drugs, I think Jen really highlighted most of what was there. I feel like there's a widespread indifference within organizations as to whether the training that people receive, and not every organization, but widespread among organizations, the training that people receive, as whether it is adequate or effective in helping them do the work. And you heard a lot of people talking about, yeah, I've come into harm reduction work, but I haven't received any training about how to do this work. Some people would say, hey, I trained the people in the organization of how to do this work. And then lots of times organizations take this attitude that, hey, you know best about what's going on, so how you do it, we'll just follow your lead. And often what it does is it puts a responsibility on people who use drugs to do work within situations and within settings where they haven't been fully trained, like even around technology or even around how to manage their own well-being. And even though there's complaints about it, like throughout the study, you hear people talk, oh, I brought it up. And then usually when people bring up like the trainings and stuff that they need, they become complainers and they get sidelined. And then people are concerned about losing the little work that they have because they look like they're going to be difficult. So the whole idea around training, as with support, is something that needs to be explored more. Because like there's some people who use drugs who really say that they really don't need any training, that they're the experts. But I say that we all go into different working situations or different situations where we need to become familiar with what's being used, the tools that are being used, and how to use them. But training is an area that needs to be fully looked at. You know, one of the things I find is that organizations tend to copy, like, okay, this has worked for another organization, so I'm going to use this, especially if I'm applying for funding, and say this is what I'm going to use, and they know that's been used successfully before, and therefore to put it through. Sometimes it comes back, and that is not really what is needed at that point in time, and it is even hard to change it then because you've got this contract with the funders that set you up. So it is that when I talk about being real, it is that ability to be able to say, okay, what is the situation here? Look at the situation and to respond to it with the training. Like people might come in from outreach and tell you like, hey, like we're dealing with this or we're dealing with that, outside it, we're dealing with this. And then you might have to, as a coordinator or a manager, decide, okay, how do we respond to this change? It might be that you've got to reach out to other organizations within the community to see if you can work together. But the point I guess I'm trying to make is that in order to I think to be effective around training and that sort of stuff, that you've got to be you've got to be open to what is happening to the environment that you're in, and you've got to be willing to respond as people say that they need you to respond. Short of that, you wouldn't really know how to train people to deal with the environment that they're working in, and you wouldn't really know how to prepare people to go into it. That's my little spiel.
Thank you for that, Michael. Yeah, and interestingly enough, we're talking about, I'm going to go to a question here to the Q&A, just so everybody knows I am looking at the Q&A. I will get that question. But I also wanted to mention, like, we're talking a lot about people who use drugs need training. The organizations themselves need training on drug use culture. And so therefore, I see it as if you're hiring people, and then the next question is about boundaries. This thing about boundaries comes up, but we're hired for our lived experience or our lived expertise of drug use, and then we're fired for that exact same thing. And we're supposed to go into these environments and know how to separate those situations and do it seamlessly without any trouble. And I think that's what I was sort of alluding to before you started talking, Michael, about the get rich and switch, right, kind of comment, is like those boundaries, your community around you is like almost like a family that's helped you survive, and you've been there together. And so that is something uniquely that organizations don't understand and that they need to get better at. It's like the organizations themselves need training on drug culture, and then they need to figure out how to work around those boundaries. I don't think it should be put back onto us. I think that there's learning on both sides. And yes, it's about developing skills for people who use drugs, but the harm reduction organizations, if they are true, authentic harm reduction organizations, they should not only be able to serve us, but they should be able to work with us. And if you can't do that, then you are not an authentic harm reduction organization, because you cannot say that you serve the population if you cannot work with our population. Bam, mic drop. No, I'm just joking. I have one to the question.
But not just work with the population, but also be led, be guided by the population.
Exactly, yeah. And so the question is, oftentimes organizations speak about boundaries when working in the community, but hire people based on those connections. How do you think the best practices will support policies to be reworked around conflicts of interest?
Yeah, we have a whole theme about dual roles and managing relationships. Again, we don't have time to cover everything in this webinar today, but it will be in the full report. And there's some really interesting tensions there as well. You know, people saying, well, you hire me because I know the community so well, but then, like Natasha said, then you punish me for being too intimately connected to people in ways that you deem to be inappropriate. And I think the bottom line is there needs to be real clarity within organizations about where they see the boundaries being, and that those policies should obviously be developed in collaboration with people who use drugs so that they're realistic and they're flexible. But also, you know, what it really comes down to is making sure there's no disadvantage or what am I trying to say? Power imbalance between a worker and the clients. So that should be the primary lens, an anti-oppression, an equity lens. That should be the lens that's put on every interaction. And you know, you can easily imagine how there might be dynamics within these dual relationships that can be problematic. So you just have to have a lot of clarity around that and make it very explicit what is within boundaries and what isn't.
Yeah. Thanks for that. I know we're starting to get a little short on time here, so I think we should zoom into the next one. But I don't know if I mentioned at the beginning. I wanted to just reiterate, or probably the first time I'm saying it, if I hadn't said it earlier, is that the best practices work is still underway. I mean, we've gotten it very close towards the end, but the final recommendations haven't been made, and we're still working through those. So please bear with us. Once that's fully done and available, we will absolutely be circulating it to everybody.
All right, so the next theme is drug use at work. And this is a really contentious issue as well, as you can imagine. And, you know, organizations profess to hold a harm reduction philosophy, but they don't always extend this philosophy, this approach to their own staff. And they could do a lot more in many cases to deliberately create a culture of normalization of drug use, creating openness and acceptance for different levels of drug use within their own staff. And the bottom line for organizations, this is Natasha's quote, check yourself. What assumptions and learned beliefs are behind your reactions to a worker using while on the job? What baggage are you bringing? What judgment are you bringing? And if people are able to perform their jobs well, there should be no judgment or bias related to their drug use. Workplace policies around workers' drug use must be clear and explicit, but also flexible and realistic, and take into account the many overlapping relationships and roles within the community of people who use drugs. So rather than forbid specific interactions between workers and clients, for example, procuring drugs while on the job, guidelines should be set around these interactions to minimize any real or perceived power imbalances. And this quote captures some of the tensions here. Our overall message is use substances so that you can stay well when you're at work, but use them so that your use doesn't impact your work in a negative way. And I think that's what people already do. I think that we're not recognizing that so many people already use substances at work. People have been for a long time, like whether that's coffee, or whether that's cigarettes or other drugs. You know, now that cannabis is legal, people use psychoactive drugs to maintain their productivity. So just using enough so that you stay well and that it doesn't impact your work negatively is going to be different for each person, but it's a helpful guide. So this is one of the organizational representatives that we talked to, what they said. So Jen or Michael, what would you like to say about this theme?
Oh, sorry, I thought Michael was going to jump in. With this one, again, I would say overwhelmingly the respondents said that it should not matter if people are using drugs, if they are capable of doing their duties. It's basically nobody's concern. I shouldn't say no one's concern, nobody's business, you know, if they are using while at work. There was some people had said, you know, you can't come in and not be in a place to do the work, and that can be triggering for other staff involved. But yeah, I mean, I would say overwhelmingly most people said that they would rather their coworkers and their team be safe and be able to check on them, check in with them, rather than, you know, creating an environment that keeps them hidden and scared to talk about it.
Yes, I heard the same things. Yeah, that people talked about, not so much about whether the person used, but how well were they able to perform the duties that they had to perform. And that seemed to be the standard that people use to measure whether a person should use or shouldn't use at work. And one of the things is that people should be able, if they were at work and you found that they were having some difficulties, whether it was from using or anything else, that they should have the opportunity to be able to take some time off to take care of themselves. And that was probably part of what one of the challenges were, that people didn't have that opportunity. So that if they felt ill, that didn't have the time to take that time off from work. But mainly it was about, yeah, whether people could do the work, then there shouldn't be any worry. You know. Also, too, there is the concern too, not only if you can do the work, but also the environment that you're working in. Like, where are people at that time with regards to that? Because the way that one organization might be able to respond might not be the way that another organization is able to respond in order to support your use. So that is also got to be a very individual thing in relationship to the organization that where you're working. And that most organizations are not at that place right now.
Oh, thanks for that, Michael. Yeah, this one here, this section here was a very interesting section for us to all deliberate on and talk about as well. And I often relate it to, we have people, like when I ran an opiate treatment clinic while I was receiving opiate treatment. I mean, so, and there was no issue with that whatsoever within my workplace. The doctor I worked with knew that, and it was accepted. And so if we have that already happening throughout the country, why then silo people from the services that they access, right? So if somebody's working in an OPS, if they can't use in that OPS, you're putting them at direct harm. So it takes away a support system if people cannot be open about their drug use and have you know, a responsive team to that. And then I had a question here. Where did it go? How do organizations support people's use of a substance at work if they're in community without a space for safer consumption and the needs are high, risk for poison substances like down? And you know, I can speak to CAPUD specifically. So in Dartmouth, Nova Scotia, we have no OPS whatsoever, and our staff, we are very open. You know, we have active people use drugs here, and it's accepted. We encourage it because some people, when they use drugs, that's when they're at their best. Just like, you know, if you were to go without your anxiety medication, what kind of a day would you have? So, I mean, we allow that here. It doesn't happen within the workspace, but it can happen into the washroom if people are being careful and letting somebody know ahead of time. Because I mean, or going off site or going to a friend's house that might be around the corner. Everybody gets breaks at work, right? Like, so if you have an hour break, you can go and get well. So I don't think you need a safe consumption space. I don't think that you need to have an OPS. You need to have the open communication with your staff, because if you break that line of communication, you're putting that individual at direct risk of overdosing and dying, because there will be nobody there. There will not be a support system or nobody to you know, respond. The other tool I would say is offering spotting or like virtual witnessing, right? You can do that with your staff very easy. You don't need an exemption. If you know one of your staff is going to use and you have an open relationship with them, you can say, hey, if you're going to go use, if you're using a new substance, if you're using alone, give me a call, I'll FaceTime you, or I can do that over Messenger. And that's another way that we can respond really quickly to issues around concerns of people using within the workspace if they don't have an OPS or an SCS. And then I'll kick it off to you guys if you have anything to add to that. All right. I guess we'll move to the next one there.
Okay. Yeah, I didn't have anything to add, Natasha. It was very well put. Finally, we're going to close with this last theme, grief, trauma, and burnout that's experienced by people who use drugs who work in harm reduction settings. And as you can imagine, this is all the more acute as we experience more and more overdose deaths from the toxic drug supply. So organizations really need to recognize the trauma, the grief, the stress, and potential burnout for workers who are people who use drugs and who are at the front lines of the war on drug users. Organizations must make deliberate efforts to provide genuine emotional and psychological supports for PWUD workers. And these supports must come both from coworkers, for example, through regular team debriefs, or from confidential access to outside counseling or therapy through hopefully comprehensive and generous health benefits. And people who use drugs should also have flexibility in their work schedule and be able to take time off for mental health and emotional breaks. So there were so many great quotes on this theme. Here's a couple. I feel like the harm reduction and peer workers field, there's so many ups and downs, and it's a big role, and it can mean so many different things. So regular check-ins and meetings. Yeah, we're all people, right? Too, and the work we do is heavy. And we can never really support other people unless we are fully okay ourselves. Michael, I'll let you take the first go at this theme because I know it really resonated with you and you did the bulk of the analysis on this one. What did you hear?
Your mute is on there, Michael.
Thanks, Natasha. I should have you wherever I go and I have to speak. Yeah, okay, but thanks. I think that one of the things that came through loud and clear is that people see that it is in the nature of the work to have to deal with trauma and have to deal with grief and loss. So the very nature of the work brings this experience of grief, loss, and trauma, and eventually burnout. Supports aren't there. And where supports are there, some people are reluctant to be supported by their organization, particularly if the concerns they have and the challenges they have involve the organization. Often the funding that is received from organizations to do the work doesn't allow for enough funds to adequately support people who's doing the work. So grief, loss, trauma, burnout, it is essential, particularly now with so many people dying. Like people talk about, I just got back from my friend's place, my friend's parents' place. They just passed away. I just heard so passed away. Like it is something that is central to the work. It is something that is central to the particular times that we're in, the particular challenges that we're living through. And it is where a lot of changes need to occur around supporting people do this work. That's what came through for me.
Go ahead, Jen.
Yeah, this section was really tough for me, and I think Michael as well. When you're interviewing somebody and they're telling you, you know, my work doesn't matter. Look at all the, you know, the death doesn't stop. Nothing is slowing down. Nothing we do makes a difference. Yeah, it's disheartening. And, you know, to hear so many different stories of people, you know, sharing their experiences and stepping out of their comfort zone to speak, for example. Yeah, and just, you know, they're giving so much of themselves to harm reduction work, and then to be dealing with so much, you know, heaviness and having nowhere to turn to heal from it. We need to do better. I think almost everyone we talked to was feeling just overwhelming grief, stress, the feeling that their work doesn't matter. and it's hard to, you know, tell them that it does, because it's real, you know. Yeah, this one was a tough one for me, no lies. As awesome as the conversations were with people, the conversation would really take a heavy tone when we got to this topic. And I mean, I'm not sure what the answers are, other than more supports. We need more supports. Some interesting ideas I heard were having like peer phone lines for people to debrief. So that's maybe not, you know, the professional type people. These are the peer workers that can call in and, you know, debrief if they've responded to a, you know, particularly, you know, a hard overdose. That's bad word, sorry. But just having a space for people to come together and talk amongst themselves without fear of being, you know, getting back to their bosses and be punished for it or whatever. We need more comprehensive supports, more appropriate supports for people. I did hear a lot about sharing circles and healing circles from the Indigenous community, which I thought was, you know, super relevant, and we need to incorporate more of that. Yeah, I wish I knew what the answers were, but we need people who use drugs doing this work to be far more supported than they are, because this is heavy stuff.
Yeah, and so another thing that stuck out for me through our you know, conversations as well is that people didn't necessarily want just plain health benefits through their employer, which was interesting. They wanted to be able to perhaps go have a massage, or you know, there was different types of supports that people had thought would be good for them on their own terms, and didn't necessarily feel like it should always be should be like a in-house counselor or like somebody like on staff that deals with this, because then there's the worry of, you know, your employer hearing all of your trauma and all those other things. So I found that was really interesting as well, to hear people actually talk about, you know, wanting to have a massage, like, or like a health wellness account of some that the organizations would have, that people could access funds for different types of services that weren't necessarily provided through health benefits or by the organization. So that one really stuck with me as well. And so a question, there's been so many questions. I know Santa and I had briefly talked about maybe just asking Michael and Jen to share briefly about their experiences as researchers, and wonder if we can just get a couple minutes from them each and then move into the questions and sort of skip over the question right now. Go ahead, Jen.
For sure. Well, this was a really humbling experience for me. It was a very positive experience for me. It came in the middle of winter in COVID, and I live out in the country, so I'm fairly isolated as it is. So to have the opportunity to talk with, you know, like-minded people as myself across the country and find out more about their work and, you know, their feelings and what's going on for them. It was truly a blessing to be a part of it. And I felt, you know, there were some calls that I had that were just so, I don't even have words for them. The connection that, you know, I'd have with certain people. And, you know, I still think about them. and I wonder if I can reach out, but would that be weird? So I mean, I said this yesterday in our prep meeting that I feel like I'm a much better writer than I am a speaker. So this project really pushed me out of my comfort zone to interview people that I don't know. So at first I was a little bit nervous and, you know, maybe felt like I had some imposter syndrome going on. But after the first couple, I really just had to, and I don't want to say let the script go, because I absolutely did not, but I had to make it more of a conversation and just be myself. I needed to be authentic, because when I wasn't, I could feel it instantly. And I feel like it would affect, you know, my conversations with people. So I really learned, you know, to just be myself and let it flow. It was a good reminder for me to be adaptable and to meet people where they're at. you know, like people, we would schedule and then something would fall apart and then we'd have to reschedule. And sometimes it would take 3 weeks to set up an interview. But yeah, it was a good reminder for me to just meet people where they're at. Another thing that I thought was interesting, I guess, the people that I saw on our list that I needed to interview with a wealth of experience who've been in this field for a long time, I was instantly intimidated, like, oh my. But those people actually were the ones that taught me the most and the best conversations, I felt. And they just flowed, like, you know, these interviews were supposed to be about an hour, and some people I talked to for almost 2 hours, an hour and a half to 2 hours, just because it was so interesting. I really enjoyed the knowledge exchange with people. I was not expecting that. People are very willing to share resources or websites or different things that they've done. So there was quite a few people that, you know, we went back and forth and they gave me a website to check out later. And, you know, so-and-so gave me this resource. And it was just really cool to feel that connection, even though, you know, I'm talking to somebody in Nova Scotia or in BC. Like, it felt very connecting.
faisait sentir vraiment très connecté. Il y a eu des choses intéressantes qui se sont produites, pour moi du moins.
I had one person who was using while on the line with me, and I didn't know that ahead of time, and it was fine. But I just found that it was interesting that we had started this interview and they said, you know, can you just give me a sec? I need to get well. Oh, yeah, for sure. You know, so I gave them a second, and when they came back to the phone, you know, made sure they were okay and they were talking, you know, they were coherent, they were fine. But just something noteworthy, you know, if this was a different type of research study and that happened, you know, what would the outcome be? Are people prepared for this? But yeah, that was interesting. And actually the same person, we had done our initial interview and we were saying goodbye. Turns out that we know the same person who actually lost their life outside an OPS in Vancouver last summer. So again, just really connecting with the participants in ways that I was not expecting whatsoever. But it was such a blessing to be able to share a little bit of our experiences in our lives and our harm reduction work.
Thanks for that, Jen. That's amazing. And when you told me that story, I was like, oh my God, spotting. I was like so happy to hear it. And it just shows the adaptability of our having researchers that are people who either currently or formerly use drugs. And Michael, I'll kick it off to you there for give a few minutes of what you thought as well, or you know, your experiences.
Yeah, I echo Jen. It was a humbling experience. Never been a research assistant that fully before. I'd done some work before, but this going through the interviews, particularly the interviews, was quite something for me. What I found with from the experience overall is, I don't know, there's a certain power, a certain capacity among people who use drugs to one, because I would think that from some of the stuff that we experienced that teach us not to trust too much. I was struck by the way that people were willing to trust me with their stories. And some of the experiences that they had, that for me was like very touching. When people would start to talk with me as though they'd known me for years. And it was simply on the basis that, well, one is that I was representing an organization that they might be very familiar with, but I was also identifying as a person who used drugs. And just being welcomed like that in people's homes, sometimes the casual conversation that you would hear going on while they were talking to you and stuff, like, it was humbling and it impressed me, really, about the power that we have to, if we can harness it together in order to work together. It was challenging as well for me. Like, I had to learn a lot of new technology and I had to deal with my own resistance to embracing technology. And here, I believe that, and I'm saying this, I believe that the researcher, Sam Patton, I believe that the support and the kind of allowing you to grow on your own terms, but at the same time being open to support, like that meant a lot to me. I mean, I think that allowed me really to like actually do the work that I did. Sometimes I didn't really know how to balance it, but that was a big experience for me, like being able to learn skills that I needed to do this work and to be supported in learning those skills while I was doing the work. I know that my second round will be something much different because I've learned a lot through this experience, and I want to thank both San and Jen because I know that Jen would be there to boost me up and to give some information every now and then, and San was overly patient, but also very, very supportive. So that stood out for me, that I could actually step up to this work, because I know that coming in from using and stuff, there was a lot of skills that I haven't developed that I could have developed had I been engaged and plugged in. So like being able to connect like that again is particularly well. One of the things that stood out, I would say probably the thing that I think about the most, it was one interviewee, and this was echoed with other people and how they saw themselves while actively using. And there was a difference in the answers for me between people who were actively using and people who had transitioned from actively using, or that people who decided they'd stop using. But there was a difference in answers. And there was this one person who had gotten into the interview section and then revealed pretty much clearly that they hadn't really worked in harm reduction. They know the field and stuff, but they hadn't really worked in the thing. And the underlying thing that came up was, why would anybody want to hire me? I am no good for nothing, so-and-so, drug this, drug that. And when you probe further around harm reduction, that person didn't see much value in harm reduction. What they saw was value in them being able to stop using. So I say, when I look at the research we were doing, and we were researching, doing research with people who had an idea about harm reduction, people who had a thought about working in harm reduction. But then I thought about the thousands, who, because they're using, don't really see their lives as having any value, either to delivering services or not delivering services. So felt like they needed to suffer through that. So that stood out for me, about the number of people who didn't really touch with the survey because they weren't really aware of that experience that we were questioning. But it was an awesome experience, a very, very awesome experience. And I thank everyone for this opportunity and also for the support. Yeah.
Thanks for that, Michael. I must say, like, I have to say, like, yay, I'm so proud of you guys. You guys did an amazing work this year. And we're more than happy to share the project with all of the people on the list after we have it finalized, and hoping to have that finished up shortly. I saw you pop on your screen here, Shay. I know we went over the Q&A. I know we were supposed to have time for Q&A, but such is life. Sorry. So did you want to say something, Shay? Go ahead.
No, I'm just here for sort of the ending. Because I was doing tech of the Stimulus Connect, I was involved in this project as well, as you know. And so I was all like, I want to be here and listen to you folks as you were to see. Yeah. So I just want to thank you all for all of your work. And all of the challenges that have been put in your way that you've absolutely hurdled and done really well. So
yeah. And you know, and truly this project was born out of my crazy idea, running into Shay's hotel room at nighttime saying, we have to do best practices, like we have to put this down somewhere. And so I hope from this this community-based research that we've done that we're going to put some really thoughtful recommendations. Believe me, we've worked like, what was it, like 12 hours back to back, days after days, going over all of this and sussing out all of the recommendations so that they're thoughtful. And they're also something that organizations can use hopefully utilize and push some policy forward in their organizations to be more inclusive of people who use drugs. And I really hope that today has given all of our attendees a better sort of snapshot of what people across the country are saying about the inequities that really exist within the work that we do, and also within conference venues and you know, workshops, focus groups. So I hope today was thought-provoking, but I also hope that you learned a lot from hearing like our two research assistants here who really led and were fundamental to this project as researchers, right? And so people who use drugs are vast in what we can do. We have lots of skills. And so if there's one thing you take away from today, I hope it is that please don't ever underestimate the people in your community, because we're resilient people. We've made it through a lot and we're still here together, kicking shit, doing our shit all over the country. So anyway, I don't know if anybody else has last closing words, but I'm super proud to sit here with you guys today, truly.
Thank you, Natasha.
And San is our lead, because we couldn't have got this done without you as well for helping us out through all of this. And I know I've challenged everybody here several times, so thank you.
So San, I didn't know until we got her biography, but she actually rose in the Atlantic every morning. And so I gotta say, you know, that's a far cry from growing up in Alberta. So good work. I wanna thank Sophie and Nick who have been here. This is them slalom simultaneous interpreting. Hopefully everything went well on your end. I do want to say, and there's Sophie waving. This is Sophie's. Sophie is excited to be welcoming a new family member into her family, and so she's going on mat leave. And so this is her last Stimulus Connect before that. So we hope she does really well, and that everything has, you know, 10 fingers, 10 toes, all the great things. I also want to thank Jen and Natasha, Michael and San for all of your work today. And of course, all of the work in the last 24 hours of just getting this sorted and together and perfect. It's absolutely amazing. Natasha, I want to hand it back to you to lead us through a moment of silence, if that's okay.
Yeah, so I mean, obviously the work that we are talking about today is so entrenched in drug policy, and drug policy has been harming many people across this country. And yeah, I hope everybody can think about, because I know I've lost so many people. I'm sure many people on this platform have as well, that have shared today with us, that, you know, I think it's projects like these that try to push progressive policy forward, so that hopefully we can start looking at a holistic way of having people supported within the organizations, because that in itself can kill people. And that in itself, not being supported within an agency is detrimental to one's well-being. And so with probably, we lost count now, 20,000 plus people maybe, like since the last number has gone up, have passed due to an overdose, you know, or drug poisoning death. I want everybody to, you know, recollect and sort of think about the lives that we've lost and how we can work together to push policy forward to change that narrative. So if you wouldn't mind taking a moment to just think about that. Thank you. And so this is for the people that we all love and lost.
I forgot to mention thanks to Savannah, who did all the background today. I'm going to turn off the recording.
Yeah, thanks for all the people that attended today.